Okay, so I work for a company called Greyhouse Publishing, and Greyhouse is a reference publisher. So we produce books and online database products for the library community. So I'm not here today to sell you insurance, not at all. What I'm here to do is to talk to you about the Medigap pricing tool and insurance ratings that is available to you through the Collierville library website. And the database that we'll be talking about in the Medigap pricing tool is a joint venture between Greyhouse Publishing and a company called Weiss Ratings. And Weiss Ratings is an expert in insurance ratings, and they provide independent, unbiased, and accurate ratings and Medicare supplement insurance data that you can rely on to hopefully help you make decisions about your Medicare supplement insurance needs. So this Medicare and Medigap discussion is designed to help you navigate through the Medicare maze. Our primary goal is to tell you about the choices you have available to you and help you save as much money as possible. At the end of this talk, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies for the least amount of money. And you can do it for free with your library card, which is really awesome. Here's what we'll cover. The major expenses that Medicare doesn't cover. When is open enrollment and what does that mean? Why Medigap can be better than Medicare Advantage, and how to get lower premiums and save hundreds, even thousands of dollars. So you might ask yourself, well, when can you join Medicare? And you can join initially in the 7 months surrounding your 65th birthday. So that is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. Now, if you don't sign up during your initial enrollment period, you can sign up during open enrollment, which runs from October 15th to December 7th each year. Now, if you turn 65 and you're still working and you're covered by your employer's insurance, you can get or sign up for Medicare when you turn 65, and that Medicare coverage will supplement the coverage provided by your employer. Now, if you have a Medigap plan now and want to change your plan or your insurer, you can do so during open enrollment, which is also each year from October 15th to December 7th, right now. Your coverage will start on January 1st for that new policy. So let's talk a little bit about Medicare coverage itself. And Medicare is divided into 4 parts. So you have Medicare Part A, which is your hospital insurance, Medicare Part B, which is your medical insurance, Medicare Part C, now those are Medicare Advantage plans, and Medicare Part D, that's prescription drug coverage. Now, Medicare Part A, that covers your hospital-related services and emergency care, like inpatient hospitalization, home health services, skilled nursing services, and hospice. But Medicare Part A does not cover all of your hospital costs, and it does not cover long-term care. Medicare Part B, that's your regular medical care, and it helps with outpatient services like doctor office visits, laboratory services, ambulance, and diagnostic services. So if you have Medicare Part A and Medicare Part B, you think you're totally covered, right?
No.
Medicare does not cover all of the costs associated with hospital and medical insurance, and it does not include prescription drug coverage. So these are some examples of Medicare out-of-pocket costs for 2021. Now, your Part A hospital deductible, that's $1,484, depending on the length of your hospital stay. And then your Part B annual deductible, that's $203 per year. And your out-of-pocket costs for most outpatient services and medical supplies, that's 20%. Your Part B monthly premium is $148.50, depending on your income. So these are some examples of what you would pay out of pocket if you have Medicare, regular Medicare Part A and Part B. And there are other hidden costs. Prescription drugs, vision, emergency care abroad, dental, and hearing aids. None of these things are covered with Medicare Part A and Part B. But you have choices and your individual needs will certainly vary. When Medicare was established in 1965, it was never meant to cover all of the medical care for your senior years, and it was intended to cover only the most basic of needs. But you have choices in regards to your health care. You can stick with Medicare Part A and Part B, or you can purchase additional coverage, and you can make this decision based on your unique healthcare needs. And generally, you have two choices to fill the gap. Those are Medicare Advantage, which is Medicare Part C, or Medicare Supplemental Insurance, which is also called Medigap. Now, Medicare Advantage, Part C, that's coverage provided by private insurance and is limited to a defined network of doctors and providers. These plans combine Part A, your hospital insurance, Part B, your medical care, and oftentimes Part D, prescription drugs. On the other hand, Medicare Supplement Insurance, or Medigap, that covers your deductibles, co-payments, and co-insurance. And those plans were designed to fill in the gaps that Medicare Part A and Part B don't cover. So let's look at them side by side. So on the left-hand side, we have original Medicare and Medicare Supplement Insurance. Now these plans do have higher premiums, but they don't have copays. You have the freedom to choose your doctor, and that means that every doctor who accepts Medicare will also accept Medicare Supplement Insurance. No referrals are necessary, but some routine services are not covered, like vision and hearing. But you're covered anywhere in the United States, and 6 plans offer coverage abroad. Now with Medicare Advantage on the other side, those plans generally have lower premiums, but they do have copays. So you'll be paying a copay each time you visit the doctor, visit the hospital, or have a medical procedure. You may be restricted to a network, and you may need referrals for specialists. But most Medicare Advantage plans include extra benefits like vision, hearing, or fitness. But outside of your service area, you're limited to emergency services only. That brings us to secret number 1. The Medigap plans offer identical coverage. Right now, there are 10 Medigap plans, each known by a letter A to N. And 2 plans, F and G, each have an additional high deductible option. For every lettered plan, every insurer that offers that plan provides the same exact benefits. The plans are regulated by the government, so the coverage within each lettered plan is the same, regardless of which insurer you choose. So that means that all Plan A's have the exact same coverage. All Plan B's are exactly the same. All Plan F's are the same. All Plan G's are the same. Because the benefits are regulated, that means that all the plans within that letter are exactly the same. And that means that you can pick the plan that has the coverage you want. You can compare one insurer to another, and you can pick the plan that has the best rate. So you might ask yourself, well, what plan is right for me? And these are some questions you might want to consider. The first is, what is your income? Using the customized Medigap report that you'll be able to access through the Collierville library, you can shop for a Medigap plan that has the most benefits that will fit within your budget. The next question you might ask yourself is, do you think you will want or need nursing care? Now, this is a hard question to answer because no one can see into the future and no one has a crystal ball. But you might consider looking at your family's medical history. If your parents or your grandparents needed nursing care, you may also need similar care in the future. So that's something to think about. The next question is, do you travel a lot overseas? which is a bit of a conundrum as we're in a global pandemic and not a whole lot of people are doing a heck of a lot of traveling right now. But if your plan is to do a lot of traveling overseas, you can get coverage for emergency care in a foreign country with plans C through G, M, and N. So when you're deciding between the Medigap plans, you can choose to pay a higher premium for more comprehensive coverage, or pay less out of for your premium and potentially pay more out of pocket. So let's take a look at the plans individually. This is a big chart. All right, so we have here the 10 Medigap plans that are currently available, A through N, and then a list of the benefits that those plans cover. And then these checkoff boxes that you see throughout the chart, these are the benefits that each plan covers. So if we look at plan A, now this has the least amount of coverage in any plan. This covers your Part A coinsurance and hospital cost, your Part B coinsurance or copayment, first 3 pints of blood, and Part A hospice care coinsurance or copayment. So that's what every single Plan A offers. Now, Plan B's, on the other hand, they add the additional Medicare Part A deductible. That's that $1,400 hospital deductible that we looked at earlier. Plan C, that adds skilled nursing facility coinsurance if you need nursing care. And then we have Plan F and Plan G. Now, these are the most comprehensive plans. And it's one of the reasons why Plan F is the most popular plan, or at least it was a couple years ago. And that Plan F and Plan G, they cover everything. Plan F covers everything that Plan A and Plan B does. Plan F adds your Part B deductible, your Part B excess, so on and so forth. Now, the only difference between Plan F and Plan G, which we'll talk about later, is this little box right here, the Medicare Part B deductible. And the difference between Plan F and Plan G is that in Plan F, those plans cover your Part B deductible. That's at $203 that in Plan F, your insurance company pays on your behalf. Now in Plan G, you pay that out of pocket. So that's the only difference between Plan F and Plan G, and more about that later. So I downloaded a sample report this morning for a 65-year-old female in Collierville. And I included in this chart the least expensive plan for each of the 10 plans, just to compare prices side by side. So a 65-year-old female in Collierville would pay $606 for the least expensive Plan A. Compare that to, say, Plan G, for instance. This 65-year-old female would pay $1,081 for the more comprehensive Plan G versus $606 per year for Plan A. So let's continue. That brings us to secret number 2, that Medigap plans are standard, but the rates are not. Insurance premiums can vary by thousands of dollars a year for the exact same coverage. So let's say that again. We talked about how the individual plans are the same. So every Plan A is the same, every Plan G is the same, so on and so forth. What the government doesn't regulate is how much that insurance company can charge you for those standardized benefits. And the pricing varies quite a bit depending on which insurance company you choose. And that's what our tool will provide to you, is a long list of every insurance company that will provide Medigap insurance for you and how much they actually cost. So here's an example. So in the report that I ran this morning for this same 65-year-old female, If she's interested in Plan G, the highest premium that I saw was $3,161. Compare that to $1,081. Now, both of these are Medicare Supplement Insurance Plan G, so the benefits are exactly the same, so you can compare them side by side. Now, these aren't like Cadillacs and hatchbacks kind of thing. The benefits are exactly the same. So the $3,000 plan, that just costs more for the same benefits. So it really does pay to shop around. That's a $2,080 difference in a year, which is a $20,000 savings over the course of 10 years. Here's another example. A 68-year-old male, also in Collierville, if he's interested in Plan A, the highest premium I saw was $3,587 compared to $775, a difference of over $2,800 per year for the exact same benefits, savings of $28,000 over 10 years. And a couple, if they're interested both in Plan G, the highest premium I saw was $6,582 compared to $2,362. Now, again, these plans are the same. The benefits are not better in one and not in the other. They're exactly the same. So you could save $4,220 per year just by switching your insurance company and save potentially $42,000 over 10 years. So you might ask yourself, well, how safe is your insurer? And that's where Weiss Ratings comes in. Weiss Ratings has been rating the financial strength of the insurance industry for over 50 years now. We use a standard report card style grading mechanism to rate the financial strength of the insurance companies. And by financial strength, we mean how can that company kind of withstand a moderate recession or a severe recession? So, how are they financially equipped to, deal with events that they hadn't planned for? And we do those ratings based on a pretty standard report card style grading mechanism. So A is excellent, B is good, C is fair or average, and D is weak, and E is very weak. And we can be a little bit of a mean teacher where it takes a heck of a lot to get an A rating from us. So that's what the Weiss safety ratings mean. So that brings us to secret number 3, that safer insurers are not necessarily the most expensive. And higher premiums don't mean you're getting coverage from a stronger, more financially stable insurance provider. And secret number 4 is that you can make the choice. You can get more coverage for less, reduce your premium, and then balance the financial safety of your insurer with your choice of plan. So let's go over the 4 secrets again. That Medigap plans offer identical coverage. The Medigap plans are standard, but the rates are not. Safer insurers are not necessarily more expensive, and you can make the choice. Now, what we're going to do is move forward and download a Medigap report from the Weiss Financial Ratings database. And you can do this for free through the Collierville library website with your library card number. And we're here to help you make the right choice for you in your specific situation, where you can pick the right coverage, you can pick the lowest rate, you can save valuable time and money, and you can pick the best and most affordable plan from all available providers customized just for you. And you can get it for free with your library card because Collierville subscribes to this helpful tool. Now, there are some questions that we should answer before we move forward. There were some changes last year. If you were eligible for Medicare after January 1st, 2020, Plan C, Plan F, and high deductible Plan F will not be available to you. If you were eligible for Medicare before January 1st, 2020, you can continue to enroll in Plan C, Plan F, and high deductible Plan F. Now, this brings us back to the chart that we were looking at before and the difference between Plan F and Plan G. And the only difference between those two plans is that $203 Part B deductible. And again, in Plan F, the insurance company pays that deductible on your behalf. And in Plan G, you pay that $203 deductible out of pocket. That's the only difference between Plan F and Plan G. And same thing with C and D. So if you really wanted Plan F and it's not available to you, consider Plan G as an alternative. And same thing with Plan D and Plan C. Now, one thing to note, because Plan F will not have new enrollees, because people who are turning 65 all the time, if they turn 65 after January 1st, 2020, that Plan F will not be available to them. So that means that the average age of people who are eligible for Plan F will continue to increase as we move further and further away from 2020. So it could potentially be that your Plan F, because the average age is higher, might be more expensive than Plan G. So, if you are enrolled in Plan F right now, just, make sure you take a look at the prices for Plan G and see if going with Plan G, which will generally have, a younger average age, might be, a better money saving opportunity for you. So the solution offered by Weiss Ratings and their customized Medigap report is to help you find and select the best Medigap policy for you with the strongest companies for the least amount of money. But naturally, every person's situation is unique. So if you have more questions, we urge you to talk to your doctor about your future healthcare needs and make sure that the plan that you're selecting will give you the coverage that you need. You can also talk to the insurance company that you've selected to make sure that your specific questions are answered. And you can talk to a SHIP counselor, which stands for State Health Insurance Assistance Programs. They offer personalized one-on-one Medicare counseling over the phone or in person to help you further. And you can locate a SHIP counselor in your area by visiting this website, www.shiptacenter.org, and click on Find Local Medicare Help in the upper right-hand corner. So let's take a look at how to get your own Medigap report. First, you're going to visit the Collierville Burch Library website. Click on the e-library button at the top, then click on Online Resources and select Business. You'll scroll down and click on Weiss Financial Ratings. Now, if you're logging in from home, select the Sign In button in the upper right and enter your library card. Then click on the Medigap tab, which is in the gray bar on the right-hand side. Enter your information and download your report. So let's do one together. I'm going to go ahead and change my screen share. And here we go. All right, so here we are on the Collierville Library website. I'm going to click on e-library and then Online Resources. Okay, so then we click on Business. And then we have to scroll all the way to the bottom for Weiss Financial Ratings. Here we are in the W's. Now this screen is going to splash for a moment and then it will forward you on to our website. In 0 seconds, there we go. Now, if you are logging in from home, I'm logged in here, but there's a sign in button in the upper right-hand corner where if you need to sign in with your library card, you can click the sign in button and then enter your library card information. Now, if you're connecting inside the library, you won't need to enter your library card information. So I'm going to click on this gray bar and select the Medigap tab, which is on the right-hand side. Okay, so that brings us to the Medigap report generator. Now, as I said in the beginning of this presentation, we're not here to sell you insurance. Greyhouse is a reference publisher. We produce books and online databases. We're not going to contact you with any insurance offers and all of that nonsense. That's not what we do at all. We actually don't collect this information in any capacity. What this screen does do is allow us to customize the Medigap report for your specific circumstances, which is your age, your gender, and your zip code. Now, you can enter your name here, or you can enter your initials or your nickname, whatever you feel most comfortable with. So I'm going to enter sample patron in this particular case. Now, the report can be anywhere from 60 to 80 pages in length, which is a lot of pages if you want to print it out at the library. Now, if you enter your email in this box, the report will be emailed to you so you can refer to it whenever you need to, or you can of course save it to a flash drive from within the library, whatever works for you. Might help if I spell my name correctly. Okay, so then the most important part, you're going to enter your age, your zip code, or your gender, and then your zip code. So let's do 38017 and then get report. So this is going to swirl for a moment and then your report will pop up, but I ran one a little earlier this morning. So this is an example of the Medigap report that you can access once you download your own from the library. And I'm going to go ahead and just show the bookmarks so we can navigate through the report. Alrighty. Okay, so the report starts with a bit of a narrative, and the first section kind of, might help you answer some questions about, how to move forward. So that first decision would be, should I seek to get better health insurance coverage than Medicare alone can give me? The next decision is, how should I cover that gap between my medical bills and what Medicare pays? Next is, which Medigap plan should I choose? And lastly, which insurance company should I buy my Medigap plan from? And this report will help you answer some of those questions. So the next question is what Medicare covers and what you would potentially pay out of pocket. So this chart has a very long list of medical procedures and medical care that you might have, and we list what Medicare pays and what you pay. And this will allow you to make some estimates of what potentially your out-of-pocket costs will be for your routine medical care based on which procedures you need to participate in each year. So for those who are, just turning 65 and, want to get an estimate of, well, what will Medicare provide to me? This chart will answer a lot of those questions. The next section is, what are the gaps in coverage? And we talk about deductibles and co-payments, shortfalls, and services that are not covered. Next, we move on to, which Medigap plan should you choose? And that brings us to that chart similar to what we were looking at in the PowerPoint presentation, and stacks the individual plans up side by side so that you can see which plan offers which different benefits. And the most important part is a section for each plan. So each plan has its own chapter and starts with a narrative of what that plan covers. And the next section is a listing of every single insurance company that provides coverage for this particular 65-year-old female in Collierville and the actual rates that they charge. Now we divide the insurance companies into our Weiss financial safety rating. So these companies in this first section have a rating of B- or higher. And you can see that State Farm Mutual has the lowest rate in this section of $606 per year. Now let's remember that all of these Plan A's offer the exact same benefits because all Plan A's are the same. What's not the same is how much they cost. So you can compare the price for State Farm Mutual at $606 compared to, say, Garden State Life at $1,232 or Pekin Life at $1,443. Now remember, these benefits are exactly the same. So you could save a bunch of money if you went with State Farm Mutual and get the same benefits that all of these other Plan A's are offering for, hopefully less money. And that's that $606 per year. So let's take a look at Plan G, which is one of the most comprehensive plans. So again, we start with the narrative of what that plan covers, and then we offer the pricing of every single insurance company that offers that plan. So for companies with a B- or higher financial safety rating, this TRH health plan at $1,081 per year has the least expensive plan compared to, say, Cigna at $1,497 or State Farm Mutual at $1,675, so on and so forth. There's another section for companies with a safety rating of C- to C+. Now, a C rating is not bad. That's just fair or average. So, we don't recommend to, turn away from companies that have a C rating. It just means they're average in terms of their financial strength. So this Great Southern Life has a price of $1,130 compared to, say, Aetna at $1,418. Now remember, all of these Plan Gs provide the same benefits. So it really does pay to shop around. And what this tool is designed to do is to make it easy for you so that you don't have to call 80 different insurance companies and, go through the motions of asking them for pricing. We do that for you. And hopefully that will save you a whole bunch of time and potentially a whole bunch of money. But if you do, and we do urge you to, call the insurance company and make sure that your questions are answered. And if you do want to call those companies, we do provide an index of Medigap insurers at the back of each report with the phone number of those insurance companies. So it's easy to, give them a call, get specific pricing for, your specific needs and hopefully get your questions answered. So let's take a look at that website one more time. So if you're going to go ahead and download your own report, you're going to go to the Collierville Burch Library website, click on eLibrary, then go to Online Resources, and we are in the Business section. And then scroll on down to the bottom to Weiss Financial Ratings. Now, if you're connecting from home, once this pushes you through to the site, there will be a sign-in button in the upper right-hand corner. If you see that, you want to click that and then enter your library card. That will log you into the platform, then click on the Medigap tab. You can enter your information specific to you and then go ahead and either download your report to your computer to access it whenever you need to, or save it to a flash drive if you are in the library. And hopefully it will kind of answer your questions about Medigap and Medicare supplement insurance, and hopefully point you in the right direction to get the best rate. So that's the tool that we're talking about tonight. I'm going to go ahead and open up the presentation for questions. So we should go ahead and stop the recording just for now to,